I do a lot of lecturing on science, and to actually share my story and come out sort of in public with who I am was very, very meaningful. And what brought me back, I'd love to say it was that feeling, but it really was the samosas, as we talked about in the car. So I really do look forward to that. So for those of you that were here, you remember last year when I talked about my personal story. And that personal story was explaining how I started back in the day as a very traditional doctor and ended up now on the podium all over this country, all over the world. And really that's all because of my personal journey, which I shared with you. And we won't go into detail there, but really that's who I am, right? This is who I am, and this is what I do. And what this is about is authenticity as the directional, the GPS system for both spiritual growth and bringing spirituality into your professional role, into your professional practice. It's all about authenticity as the first step. And that's why I call this the clinician as healer. Now, the directions that were given to me for the next 15 minutes are to try to make this as much of a TED talk as possible. And that, of course, pushes me to my edge, which is how do I give a talk that doesn't have science and articles and research? So somehow I was able to find a ton of science and research about spirituality. I am not going to go into that in depth at all, but just show you some of this so that you see there is actually a scientific basis for what we know as human beings to be true. Because sometimes we need science to give us support for doing what comes to us naturally, right? So, for example, in many nursing homes, residents weren't allowed to have any control of the paintings or the artwork in their rooms until a study came out that said if you let patients actually arrange the artwork in their room, they do much better and actually live longer. And so then you now see nursing homes gradually, it still isn't uniform, gradually allowing that side of those things to happen. So what I'm showing you now is the science that justifies not only what we know, but what we just heard so eloquently about how patients need and how wonderful it is to have hospitals that pay attention to the spiritual needs of their patients. So very, very quickly, we all know that we've got our physical body. We all know that there's a soul that's of divine origin that's in every religion. We call it Atma, in my personal belief. And that physical body is not who we really are, right? We all know that. They're illusions because they don't exist. Who we really are is the Atma, that which does not change. And all faiths give us guidelines of how we need to behave as an inhabitant in the physical body. And those rules are what allow us to achieve soul growth for our Atma, right? So having a conversation with a patient, and it's a little out of what our training was, because our training was to talk to patients about the ailments that are affecting their physical body. And now we're shifting that conversation to talking about that part of them that's real. So it's not like the first thing I say is, well, this cancer you have isn't real and the body you have isn't real, so don't worry about it. So don't take me literally and go out and do that tomorrow, please. But by knowing that, it creates a sense of ease in me as the clinician. It creates a sense of ease in me as the caregiver. And I encourage patients to start some sort of a spiritual process such that they can come to that realization themselves. And that helps them physically, because then they release some of the stress or the pressure to get well. So we need to think about it, and that's what I introduce. And that's the important first step, because of course we experience what we think. If we think that there is only pain and suffering ahead, if we think that nothing happens after we die, that this is just it, of course that's going to be a stressor. And so therefore thoughts are very powerful. But we already know that, right? Because if you think that you're overweight when in fact you're not, if you look in the mirror and you see that you're overweight but you're not, that's the perception, that's the reality for you. And that's more important than the objective fact. And so that's why thoughts and perception are more important than reality. So if we're not happy in our circumstances, we're not going to be happy no matter how good the circumstances might be. If we don't think we have enough money and we're jealous because we look at someone that has more, it doesn't matter how much we have. We all hear the stories of people with millions of dollars that are unhappy because someone else has hundreds of millions of dollars, right? So it's not what we have, it's what we think. It's our perception. And that stress response, if we perceive that we're stressed, that's not good, right? That leads to high blood pressure, etc. And I'm not going to go through all of the negatives of stress because we all understand that deeply because we experience it, right? We experience. And so when we say we are what we think, it talks about how our thoughts impact our physiology and how our thoughts impact the way our body functions. And it also suggests that our thoughts impact us spiritually because we are more than just our physical body. So, right thought, right mind, right action. One of the principles when you're on the spiritual path is trying to control your thoughts. So, what are the ways our thoughts impact the non-physical part of ourselves? Right? We can also look at the soul as the higher self and the personality as the lower self. How do we keep our thoughts away from anger, greed, jealousy, resentment, lack, I don't have enough, or I am not enough? That's lower self thinking. And almost every religion talks about a higher and a lower self. And talking to patients about change and transformation is the way to present this information. How do patients, or how often do patients ask for help in getting out of the rut that their lifestyle has brought them, or the rut that lifestyle has brought them to chronic illness? So it's all about change. It's all about transformation. So change, the difference between change and transformation, change is causing to be different, and transformation is a significant alteration. It's not just a progression, it's a significant alteration. And this happens, it's an aha. It's when someone finally gets it. It's when we get chills, confirmations, however we experience it, and it's different for all of us. And what we need to do as clinicians is to create an environment that allows transformation to happen. And we facilitate change through our caring and compassion, giving instruction, holding patients' hands about what to do to help them physically. So all transformation involves change. You can't have that aha without change. But people change without a transformation. And when we're talking about spirituality, we're talking about a transformation. I would summarize that transformation is to have patients understand who they are. That's the transformation. That's the aha. I am Atma. I am more than my physical body. I will do my dharma to take care of my physical body. I will do my dharma to take care of my physical illness. But I am not just that physical body. That's the transformation. And I like to believe when patients walk in, they're ready for it. And that's my role, is to help that change and that transformation to happen. And so it's just offering that love and support. That's what it's all about. So, helping people be in the moment, authenticity. Authenticity is you being comfortable enough with who you are and helping patients to be who they are. And that's what's the deeper connection. Being brave enough to say, I don't know if you'll survive this stage 4 cancer, but I'll be with you every step of the way. Where love meets suffering. That's where this happens, with demonstrating compassion and listening with intention and reflecting back, letting them know that you feel their pain, to use that cliche, but that you understand what they're going through. Healing is about recovery, repair, and restoration. It's not about the elimination of disease. So if we like to think of ourselves as healers, and I would say that I don't think of myself as a healer, I like to think of myself as a conduit that allows healing to happen, and I actually have to step out of the way to let that happen. But whether you think of yourself as a healer, or you just want to allow the healing process to happen, the end result that you're hoping for with your patients is their return to wholeness. And what's wholeness? Wholeness is this realization, this understanding that they are more than their physical body. Healing is just the absence of whatever the physical ailment is. That's not what, healing is exactly what we're talking about. Curing is the absence of that physical ailment, right? And healing has a derivation linguistically of being something of divine origin, which is why physicians have always, of all types, healers of all types, have always been held in such high esteem culturally up until now. So how can we make someone whole if we don't know who they are? So what lies behind us and what lies before us are tiny matters compared to what lies within us. What lies within us? That which does not change, our Atma. So this is the scientific drawing of these big words, which essentially say the same thing. So you talk about a field of transpersonal psychology. It's all about we are one, right? Sounds very esoteric. So illness, this concept of illness is a gift. And again, you don't say to someone who's just been diagnosed with a terminal illness, oh, this is really a gift. You just don't see that yet, right? You don't say that. But historically, this is the way illness has been viewed. Like, you know, I learn when I research these talks. Hippocrates, a wise man should consider that health is the greatest of human blessings and learn how by his own thought to derive benefit from his illnesses. I was stunned to know that this came from Hippocrates. We talk about the journey, right? Illness is a journey, starting with denial, then acceptance, then the healing can happen. So I'm going to now skip the rest of this because you can have access to all of these slides about how you can humanize yourself. Spirituality is the point of connectivity for all areas of health, the connection to something greater, a little bit different than religion, which formalizes it and tells people how to do certain things. But there is something called the re-spiritualization of medicine that's going on. That's why this conference is filled. This room is filled. That's why this conference is being held. You are not alone in being interested in this topic. It is happening. There's data. This is what I was alluding to in the beginning, that I need some data. So there's data here. Patients care, doctors believe there's something, and we pray, we hope that things happen. So what I'm going to do now in my 2 minutes that are left is use 1 minute to tell a story and 1 minute to do a bit of an exercise. So the story is being shared because one of the questions is, well, how do you use spirituality in your practice? So I got a phone call, and this is very recent, 2 or 3 weeks ago. A couple referred to me from California, and one of the couple was a medical student, and they just lost a child at 6 months of age through a combination of medical malpractice, or I should say what seems to be medical malpractice, and death from a vaccine-preventable illness when they had chosen not to vaccinate their child. So this was a 1-2 punch in addition to the horror that comes with losing a child. So I got the call, is there something that I could say to them and help make them feel better? And I said, sure, this is a divine invitation to be of service. We talk about seva, and that's what this was. And I said, well, with my crazy schedule, the only time I could do it is Saturday, last week. They're like, well, we'll see. Anyway, they get back to me. It turns out that that was the day of the memorial service. And I said, well, it's okay if they can't do it. And they said, no, we absolutely want you to do this. So I spoke to them 3 hours before the memorial service. And my beginning of the conversation, for those that wonder how do you start with that, it was, I really can't even imagine what you're feeling, but in order for me to be most helpful, tell me, and this is a conference call, so both of the couple were on the call. I want to know how you're doing emotionally, I want to know how you're doing spiritually, and I want to know what you'd like to get out of this call. That's how I started it, very simple. And of course, guilt, sadness, and grief. And what did they want to know? They wanted to know that Maddox was okay, and that Maddox wasn't angry for what they did. And the guilt was not only about the vaccine, but it was not recognizing the signs to go above what the ER doctor was saying. So when the ER doctor was saying this baby's fine, and they knew that, and they didn't push hard enough to say, I want somebody senior. They wanted the guilt of that addressed. So what was it all about? Just to summarize, Maddox is more than his little body. And again, it's getting them there step by step, but this is what they believed. And talking about guilt, that you can't feel guilty about your intentions, right? Your intentions as parents to do the best for your child. We can't always make the right decisions. But with vaccines, whichever route you pick, it's fraught with risk. Sometimes, no matter what our choices are, they're risks, right? So if you do vaccinate and your child gets a fever and then becomes autistic, you have guilt in that area. If you don't vaccinate and there's a vaccine-preventable illness that strikes your child, you have guilt there. And you never know what's going to happen. So we talked about that, but most importantly, we talked about, is Maddox okay, and is he more than his physical body? And then I did an exercise with them, which we're going to do right now. So I'd like you to just get comfortable in your chairs and close your eyes. If you're not comfortable closing your eyes, it's okay. You can keep them open. But breathe in through the nose, out through the mouth. In through the nose, out through the mouth. Allowing yourself to sit comfortably in the chair, feeling supported as you let your shoulders soften, your back relax. Breathing in through the nose and out through the mouth. And as you're doing this breathing, I'd like to bring your focus over your heart. Breathing in through the nose, out through the mouth. And if you can imagine that breath coming in and out from your body through your heart. And as you're over your heart, just an awareness that you are more than your physical body. And can you connect with that part of you, that Atma, that non-physical part of yourself that's within each and every one of us. And knowing that that connection transcends time, space, and physical boundaries. So use that power, that connection to connect with your Atma, and if you have a question about life, see if an answer will come. If there's a relative that's left their body, see if you feel a connection, if there's love that you feel you need to express to someone or something, do it. Gratitude. Gratitude for your circumstances, with the challenges that we all have. Whatever is in your heart, connect with it. And know that you can always come back to this place. This is the part of you that does not change. This is the part of you that does not change. And just take a few seconds to express gratitude for whatever just happened, a communication, a message, an expression of an emotion. Know that you can always come back and do this at any time, and just open your eyes and put a smile on your face. Thank you. Thank you. Thank you. And so this is what we do. This is the healing paradox. This is patients talking. This is what we're looking for in search of something more than a cure. We call it healing. If you were robbed one day, and if by the next day the robber was caught and all your goods were returned to you, we'd only feel partly restored. You would be cured but not healed. The sense of violation would remain. Similarly with illness, a cure is good, but we want the healing as well. We want the magic that good physicians provide with their personality, their empathy, and their reassurance. And that's what I wish for all of you. Thank you.